Capgras Syndrome. Capgras Syndrome is a psychological condition. It's also known as imposter syndrome or Capgras delusion. People who experience this syndrome will have irrational beliefs that someone they know or recognize has been replaced by an imposter. They may, for example, accuse a spouse of being an imposter of their actual spouse. This can be upsetting for both the person experiencing the delusion and the person who is accused of being an imposter. In some cases, the person experiencing the delusion may believe an animal, object, or even a home is an imposter. Capgras syndrome can affect anyone, but it's more common in women. In rare cases, it can also affect children. The syndrome is named for Joseph Capgras, a French psychiatrist who explored the illusion of doubles. Capgras syndrome is most commonly associated with Alzheimer's disease or dementia. Both of these affect the memory and can alter your sense of reality. Schizophrenia, especially paranoid hallucinatory schizophrenia, can cause episodes of Capgras syndrome. In rare cases, a brain injury that causes cerebral lesions can also cause Capgras syndrome. This is most common when the injury happens in the back of the right hemisphere, as that's where our brains process facial recognition. People with epilepsy may also experience Capgras syndrome in rare cases. There are several theories on what causes the syndrome. Some researchers believe that Capgras syndrome is caused by a problem within the brain, like atrophy, lesions, or cerebral dysfunction. Some believe that it's a combination of physical and cognitive changes in which feelings of disconnectedness contribute to the problem. Others believe that it's a problem with processing information or an error in perception, which coincide with damaged or missing memories. Right now, there is no prescribed treatment plan for people with Capgras syndrome because more research needs to be done. But there are treatment options that may help relieve symptoms. Treatment aims to address the underlying cause. For instance, if someone with poor symptom control and schizophrenia experiences Capgras syndrome, treating the schizophrenia can improve the Capgras syndrome. However, if the syndrome occurs during the course of Alzheimer's disease, the treatment options are limited. The most effective treatment is to create a positive, welcoming environment where the person affected by the syndrome feels safe. Some clinicians will use validation therapy. In validation therapy, delusions are supported instead of rejected. This can reduce anxiety and panic in the person experiencing the delusion. Reality orientation techniques may be helpful in some circumstances. This means that the caregiver gives frequent reminders of present time and location, including reminders of major life events, moves, or any substantial changes. The underlying cause of Capgras syndrome will be treated as much as possible. These treatments may include medications like cholinesterase inhibitors, which boost neurotransmitters involved in memory and judgment for dementia and Alzheimer's disease, antipsychotics and therapy for people with schizophrenia, surgery, if possible, for brain lesions or head trauma.